The only thing worse than feeling lousy is being told that your symptoms are all in your head. There's nothing so frustrating than when the doctor reads your lab results saying, "Good news, your lab results looks great, everything is normal, you are the picture of health," when you actually feel like everything is not okay. You're a lot better off being bored than being scared. When you're experiencing strange pains, mysterious issues, or other unexplained symptoms, you would hope that a trip to the doctor will solve your health woes. But sometimes doctors have just as much trouble identifying certain disorders and conditions as your patients. And the harder an illness is to determine, the more likely you are to get the incredible frustrating all-in-your-head diagnosis. From chronic fatigue to the exploding head syndrome, here are top 10 disabling illnesses doctors think are only in your head. Number 10. Chronic pain syndrome. Chronic pain is any pain that lasts for more than 3 months. The pain can become progressively worse and reoccur intermittently, outlasting the usual healing process. After injured tissue heals, pain is expected to stop once the underlying cause is treated. According to the conventional ideas of pain, however, chronic pain can persist after injury is healed for no apparent biological cause. Most common sources of chronic pain include lower back pain, headache, arthritic pain. Chronic pain can cause significant psychological and emotional trauma and often limits an individual's ability to function fully. Every injury has an expected period of time to recovery. If pain lasts for longer than what seems normal, further evaluation is necessary. But most of the time, most people often end up getting the all-in-your-head response. Number 9. Irritable bowel syndrome. This gastrointestinal disorder, characterized by bouts of recurrent abdominal pain and diarrhea, has no known cause but is often triggered by anxiety and stress. It also involves miscommunication between the brain and the gut regulation, which is why it's sometimes believed by doctors to be all in your head. Although psychological factors are not primary cause of IBS, they can affect how a person manages and copes with the symptoms, such as becoming fearful of having an attack in social situations because of a lack of an identifiable physical cause. It was recommended that patients suffering from the disorder undergo some form of psychotherapy and perhaps an antidepressant medications as well. Number 8. Chronic fatigue syndrome. Chronic fatigue syndrome is a complicated disorder characterized by extreme fatigue and can't be explained by any underlying medical condition. The fatigue may worsen with physical or mental activity, but doesn't improve with rest. The condition is also known as systematic exertion intolerance disease. The cause of chronic fatigue syndrome is unknown, although there are many theories ranging from viral infections to psychological stress. Some experts believe that chronic fatigue syndrome may be triggered by a combination of factors. There is no single test to confirm a diagnosis of chronic fatigue syndrome. You may need a variety of medical tests to rule out other health problems that have similar symptoms. Treatment for chronic fatigue syndrome focuses on symptoms relief. The feeling that a chronic fatigue syndrome will result in serious and debilitating physical symptoms is just a psychological disorder is so widespread that the Institute of Medicine felt it necessary to put to rest once and for all the idea that this is just a psychosomatic or that people may be making this up or that they are just lazy. Number 7. Lyme disease. Caused by the bite of an infected tick, Lyme disease starts with vague symptoms including fever, headache, and fatigue, along with a skin rash. Left untreated, the infection can spread to the joints, the heart, and nervous systems. It's often hard to diagnose due to the ambiguous symptoms. Most people who have Lyme see a doctor when symptoms worsen and they have a joint pain or neurological issues like foggy brain or forgetfulness. But then the doctor may want to explore a whole host of causes, so the workup may take time as other conditions are dismissed. Even though that study professes to have proved that chronic Lyme disease indeed exists, other doctors remain doubtful and believe that any improvement in symptoms patients experience is nothing more than a psychosomatic response. Number 6. Fibromyalgia. Widespread pain, sleep problems, fatigue, headaches, tingling of the hands and feet, along with cognitive issues such as memory loss, can all be symptoms of fibromyalgia. There is no single spinal nerve, muscles, bone, or other definable sources that can explain the variety of symptoms patients can experience, doctor says, which makes it tough to diagnose. Plus, since depression and anxiety may also accompany these vague symptoms, doctors sometimes conclude that it's all in your head. In addition to ruling out other diseases, confirming the diagnosis is determined by a widespread pain index, which rates and catalogs where you have been experiencing pain. Though recent estimates have indicated that 5 million people suffering from fibromyalgia in the US alone, there are still many doctors who express the disbelief in the existence of the condition altogether. Number 5. Exploding head syndrome. Exploding head syndrome is a disorder characterized by the perception of loud noises, such as a bomb explosion, gunshot, or sunrise crash when going to sleep or awakening. Other symptoms include flashes of light, an intense feeling of heat, chest pain, and the feeling of an electrical sensation throughout their body. Contrary, it is not associated with pain. However, the noise attacks can elicit a great deal of fear, confusion, and distress in sufferers. Reports of palpitations are also common. Despite the distressing natures of EHS, relatively little is known about the prevalence and underlying cause of the condition. Some scientists have estimated that EHS may affect 10% of the population. Females tend to be more at risk than males, and the average age of onset is 50 years old. Causes of EHS are believed to include common issues such as stress and fatigue, with other sleep disorders also considered as likely playing a role. So far, doctors have found that simple reassurance is similarly the best treatment, and one sufferer's symptoms ceased due to his doctor's assurance that his EHS was nothing more than an inconvenience. Number 4. Somatization disorder. Somatization disorder is a psychiatric condition marked by multiple medical unexplained physical symptoms. In order to qualify for the diagnosis of a somatization disorder, somatic complaints must be serious enough to interfere significantly with the person's ability to perform important activities such as work, school, or family and social responsibilities. Individuals with somatization disorder suffer from a number of vague physical symptoms involving at least 4 different physical functions or parts of the body. They often use impressionistic and colorful languages to describe the symptoms, describing burning sensations, pains that move from place to place, strange taste on the tongue, tingling, or tremors. It is important to note that while the physical symptoms of somatization disorder frequently lack medical explanations, they are not intentionally fabricated. A typical person with somatization disorder has suffered from physical pain, discomfort, and dysfunction for an extended period of time and consulted several doctors. While the symptoms of the disorder are seemingly limitless, the absence of an identifiable physical cause has led many doctors to believe that the disorder is simply psychological, and it is therefore frequently dismissed altogether. Number 3. Convention disorder. Convention disorder, future nervous system, neurological symptoms that can't be explained by a neurological disease or other medical condition. However, the symptoms are real and cause significant distress or problems functioning. Signs and symptoms vary depending on the type of functional neurological disorder and may include specific patterns. Typically, these disorders affect your movement or your senses, such as the ability to walk, swallow, see, or hear. Symptoms can vary in severity and may come and go or be persistent. However, you can't intentionally produce or control your symptoms because a functional neurological disorder is unknown. A condition may trigger by a neurological disorder or by a reaction to stress or psychological or physical trauma, but that's not always the case. The disorder is not common as it is estimated to affect only 0.03% of the population. Number 2. Retired husband syndrome. Some people are like clouds. When they go away, it's a brighter day. It is a stage when a husband and wife finally have the chance to spend time together, free from the stresses and strains of work and life. But far from being an era of a relaxed contentment, retirement can be a stressful experience for couples. Many wives began to suffer from retired husband syndrome once their men gave up work. Part of the cause of greater stress was that the women were faced with an increase in housework. They also had to deal with the added burden of a reduced income. An extra concern for both partners. The psychological ailments that develop are caused by stress. And the stress is often due to the very strict gender rules that have existed in Japan for centuries. The effect of Irishers have resulted in a divorce rate that have increased significantly. Between 1985 and 2000, the rate of divorce among couples married for longer than 20 years doubled. Though married women in Japan are finding themselves afflicted with physical symptoms, doctors have not been able to find any other medical cause for the symptoms other than the psychological stress of the retirement of their husbands. Number 1. False pregnancy. A woman's intuition is a funny thing. Most women know they are pregnant before they are even far enough along to take a test. We know our bodies, and when something is different, we can just feel it. What about the phantom pregnancy? There are times when even a woman's intuition is off and our body tells us we are pregnant when in fact we are not. This is a phenomenon called pseudocyesis or false pregnancy. Pseudocyesis is the medical term for the false pregnancy or what some people refer to as a phantom pregnancy. A false pregnancy is characterized by typical pregnancy symptoms including weight gain, growing belly, morning sickness, irritability, and backache, all the signs of being pregnant without carrying an actual baby. In addition to being common, pseudocyesis symptoms pose an uncomfortable and often frustrating challenge, both in diagnosis and management. As with many conditions, the doctors believe are all in the patient's head. Pseudocyesis often represents quite a significant hardship for those suffering from the syndrome. Okay, so what conditions have you suffered from in the past where the doctors put it to the incredible frustrating all-in-your-head diagnosis? Comment below and let's share some light on it. If you love this video, don't forget to subscribe and also hit that bell icon so that you can get notified each time we upload fresh content.